Hello friends, welcome back to my channel. In this video, I am going to explain you about arteries of upper limb. So we are going to see only outline of arteries of upper limb, and in this topic we are going to see about axillary artery, brachial artery, radial and ulnar artery, superficial and deep palmar arch and its branches. That is origin, termination and its branches only we are going to see in this video. Now let's move on to the video. The first one is axillary artery. So subclavian artery and its branches is going to give blood supply to upper limb. Axillary artery, it is continuation of subclavian artery. So this axillary artery arises from the outer border of first rib. Arises from the outer border of first rib and it terminates at the level of lower border of teres major. And this artery, this is the axillary artery. And this continues as brachial artery. A brachial artery divides as radial and ulnar artery. So now we are going to see only the axillary artery. It arises at the outer border of, that is continuation of subclavian artery is axillary artery. At the level of outer border of first rib, axillary artery continuous and it ends at the level of lower border of teres major. So this artery divides into three parts by pectoralis minor muscle. So it is divided into three parts by pectoralis minor muscle. In front of the pectoralis minor, that is your first part, and behind, that is second part, and below the pectoralis minor, that is the third part. From the first part, it is giving only one branch, that is superior thoracic artery. From the second part, it is giving two arteries. One is thoracoacromial artery and other one is lateral thoracic artery. From the third part, it is giving three branches. The largest subscapular artery, the subscapular artery giving a branch, that is circumflex scapular artery, and two branches, another two branches, anterior circumflex humeral artery and posterior circumflex humeral artery. So these are the branches which are arising from axillary artery. Now the axillary artery is getting into terminate at the level of lower border of teres major. From the lower border of teres major, it is continuous as brachial artery. So now we are going to see about a brachial artery and its branches. Now this axillary artery continues as brachial artery below the level of lower border of teres major. So this is brachial artery. This terminate at the level of neck of radius. This is the radius bone and this is called head of the radius and this is neck of radius. At the level of neck of radius, it terminate as radial artery and ulnar artery. Lateral side, that is radial artery, and along the medial side of the forearm, that is your ulnar artery. So brachial artery is the continuation of axillary artery below the level of lower border of teres major and it terminates at the level of neck of radius and giving two terminal branches. One is radial artery, that is along the lateral side of forearm, and another one is ulnar artery that runs along medial side of forearm. So now this artery, this brachial artery is giving superior ulnar collateral artery and inferior ulnar collateral artery, and along the posterior it is giving profunda brachii artery. So it is giving three branches, superior ulnar collateral, inferior ulnar collateral, and on the largest branch, that is profunda brachii artery, which passes through the lower triangular space, that is crosses the spiral groove and it enters into the lower triangular space. And it is giving this profunda brachii artery, it is again giving two more branches, that is radial collateral artery and middle collateral artery. and two terminal branches, radial and ulnar artery. So these are branches of brachial artery. So now these branches getting into anastomosis around the elbow joint. So there is a more flexion and extension or doing in the elbow joint. So to prevent the kinking of the blood vessels during flexion of elbow joint, here anastomosis occurs. So what are those anastomosis? So here the superior ulnar collateral artery which anastomoses with posterior ulnar recurrent artery and inferior ulnar collateral artery anastomoses with anterior ulnar recurrent artery. So like in the lateral side, this radial collateral artery which anastomoses with radial recurrent and middle collateral artery anastomoses with interosseus recurrent artery. So these are the anastomosis arteries which get anastomosis around the elbow joint and causes easy blood flow even if there is during flexion of elbow joint. So now we are going to see a radial and ulnar artery and its branches. At the level of neck of radius, ulnar artery is coming downwards along the medial side, and this ulnar artery, it is giving three branches. Ulnar artery is giving three branches in the forearm, that is anterior ulnar recurrent, posterior ulnar recurrent and common interosseous artery. So it is giving three branches, three main branches: anterior ulnar recurrent, posterior ulnar recurrent, this involved in elbow anastomosis around the elbow joint, and another one is that is common interosseous artery. This common interosseous artery, it get divides into anterior and posterior interosseous artery at the upper border of the interosseous membrane. Okay, so this from the posterior, this is anterior, that one is anterior interosseous artery and this one is posterior interosseous artery. From the posterior interosseous artery, interosseous recurrent artery arises that will get anastomosed with the middle collateral artery. So that is seen in elbow anastomosis. So now once again I'll say about ulnar artery. So this is ulnar artery. This giving anterior ulnar recurrent, posterior ulnar recurrent and common interosseous artery. This common interosseous artery divides as anterior interosseous artery, posterior interosseous artery. Posterior interosseous artery giving a branch that is called interosseous recurrent artery which involves in anastomosis around the elbow joint. And this ulnar artery near the hand, it is giving superficial palmar arch. So now radial artery is the one which arises from the brachial artery, that is one of the terminal branch of brachial artery which runs along the lateral side of the forearm. This giving a branch in forearm, that is radial recurrent artery, that will anastomose with radial collateral artery around elbow joint. It descends downwards near the wrist, it is giving another branch, that is palmar carpal arch, and on the dorsal aspect it is giving dorsal carpal arch. This palmar carpal arch anastomoses with the palmar carpal arch of ulnar artery in anterior aspect of wrist joint. And in the dorsal aspect, so this radial artery giving dorsal carpal arch, that will anastomose with dorsal carpal arch of ulnar artery. So now we'll see the common interosseous artery. This common interosseous artery giving two branches, that is anterior interosseous, posterior interosseous. Anterior interosseous artery, it is giving anterior carpal arch, that will anastomose with palmar carpal arch in the wrist joint, near the wrist joint. And posterior interosseous artery, that is giving a dorsal, that is giving a posterior carpal arch, that will anastomose with dorsal carpal arch of radial and ulnar artery, which is seen around anastomosis around the wrist joint. So once again I will repeat, common interosseous artery divides as anterior and posterior interosseous artery. Anterior interosseous artery, it is giving anterior carpal arch. Before it anastomose with posterior interosseous artery in the lower border of uh, interosseous membrane, it is giving anterior carpal arch that will anastomose with palmar carpal arch of radial and ulnar artery. And posterior interosseous artery, that will giving a branch, that is palmar posterior carpal arch, that will anastomose with dorsal carpal arch of radial and ulnar artery. So this is how anastomosis occur around the wrist joint. So now this ulnar artery, it runs downwards near this base of the metacarpal bone. It forms an arterial arch, that is called a superficial palmar arch. So here this is the ulnar artery and this forms a superficial palmar arch. The superficial palmar arch, it lies deep to palmar aponeurosis and it lies superficial to long flexor tendon, lumbricals and all. And this superficial palmar arch anastomose with superficial branch of a radial artery. And this superficial palmar arch giving, that is a proper digital artery, one proper digital artery and three common palmar digital artery. This three common palmar digital artery divides into two proper digital artery. Each common palmar digital artery divides into two proper digital artery. And this is how it supplies to medial 3.5 fingers. The next one is a deep palmar arch. So this deep palmar arch, it is arises from radial artery and it anastomose with deep branch of ulnar artery. This deep palmar arch, it is giving a branch, that is arteria princeps pollicis and arteria radialis indicis. So this two branch, there is one proper branch, arteria radialis indicis and arteria princeps pollicis. This branch supplies the lateral 1.5 digits. And another branch which is goes to the dorsal aspect of this hand, and it is giving a branch, that is first dorsal metacarpal artery. It passes between the first dorsal interosseous muscle, and in the dorsal aspect from the dorsal carpal arch, it is giving three dorsal metacarpal arteries. That three dorsal metacarpal artery anastomose with palmar metacarpal arteries, that is arises from deep palmar arch. So deep palmar arch giving three branches here, that is arteria princeps pollicis, arteria radialis indicis and three palmar metacarpal artery. This three palmar metacarpal artery anastomose with dorsal 3 metacarpal arteries. That dorsal 3 metacarpal artery is a branch of dorsal carpal arch. So dorsal carpal arch, it is derived from the arteries of ulnar and radial around the wrist. So this is how the arteries which is supplying in dorsum and palmar aspect of hand. So this is the overall outline of artery and its branches. I think this will be helpful to understand the overall branches of the artery in upper limb and how it is supplies the whole region of the upper limb. I think will be useful to all the students those who are seeing this video. Thank you friends. Thank you for watching this video. If you like this video, please share, subscribe and don't forget to click the bell icon.